So we're here with Pathway Healthcare. I'm Jessica Turner and this is Chase Sims. We're part of the corporate support team. We have with us today one of our CMOs, Dr. Stephen Taylor. And he graciously came in and was willing to film this video with us. And we wanted to talk a little bit about yesterday's news and press releases about the opioid takedown in the Appalachian region of the United States. So Dr. Taylor, where were you yesterday when you heard the news?
I was literally driving home. I had been out of town doing an appearance to talk about the opioid epidemic, and was driving home from the airport and had a chance to speak by phone with Dr. Brent Boyette, our other CMO, and he was the one who told me about it.
What was your first thought?
You know, my first thought was that here we are in the midst of an opioid epidemic in which, on average, 130 people are dying every day from opioid overdoses. It seems unconscionable to me that we still have doctors essentially functioning as drug dealers with MD degrees, and it's an outrage, but it's more sad because you think about patients who have chronic pain syndromes or varieties of other illnesses going to a doctor to try to get help, and instead what they're receiving is a doctor either because of careless and reckless prescribing of opioids or because of outright illegal behavior to try to capitalize on the patient's needs. They're actually creating an additional illness for the patient in many cases, namely the illness of addiction. And so now, not only does the patient have a chronic pain syndrome or whatever other illness they now have an addiction illness, which is itself a chronic, relapsing, potentially deadly illness.
So you would say this has been a good thing for our communities?
Well, I think it's been a great thing that doctors who are engaged in reckless, dangerous, or outright horrifically illegal behavior have been arrested and have been stopped from doing that. That's a great thing. And the fact that patients who have been harmed by their doctors instead of helped by their doctors are no longer under the care of those doctors, I think that's a great thing. But it's now the next step that we have to take to make it really a great thing, and that is to get those folks the help that they need, to get them treatment for the problems that they have, both the problems that first brought them to the doctors that they were seeing and the new problem that many of them may have, namely that of an addiction disorder to opioids.
Right. And I know a question that would arise would be, what are these patients going to do?
That's right. And you know, one of the important things to understand is that we have been growing as a medical profession and as a society in our understanding of what's the proper way to deal with someone who has a chronic pain syndrome. What's the proper kind of treatment for that? Back in the late 1990s, many of us doctors were fed a bill of goods about, or sold a bill of goods about how harmless opioids were, and how we should just prescribe them as much as necessary to completely eradicate people's pain, and that was the priority. We now understand that proper treatment of a patient's chronic pain problem involves some calculation of how much functioning we're restoring to that person, and it often doesn't involve completely eradicating pain, and therefore it doesn't necessarily involve use of opioids, particularly for non-cancer chronic pain, and that there are several other evidence-based treatments available. And so one of the important things that the company that I'm involved with, Pathway Healthcare, that we have made our mission is to provide evidence-based, compassionate, non-judgmental care to people who have addiction disorders, who have chronic pain syndromes, and who have the co-occurring mental health conditions that often go along with those two. And the way you do that is not, in the main, by prescribing people opioid medications. And so one of the things that we're hoping to do is to take care of people who need that help in a non-judgmental way, in a caring, compassionate way, and hopefully we're going to be part of the solution Because unfortunately we've had some doctors out there who continue to be a part of the problem.
Right. I think for me personally, reading this story, thinking about the people who lost their providers and who are struggling with a dependency or addiction, my thoughts towards them in the moment were, wow, I hope this helps them decide to take a step forward and get treatment, right? And get the right kind of treatment, to get the right kind of help, and to no longer, fight this battle of addiction and dependency. That it could possibly not be what maybe looks on the outside as a bad thing for them, could in turn restore their life.
I absolutely agree. I think one of the problems for many people who have a doctor-induced addiction, which is what we're talking about for many of these people, and just having to acknowledge that is actually painful for me. But many folks who have that, one of the barriers for them getting care has been the stigma itself, the shame. People throwing around the term addict, okay, when that term shouldn't even be used. I mean, the fact of the matter is we don't take care of addicts.
Right.
In 25 years of practicing addiction psychiatry, I've never met an addict. I don't know what that is. I do know what a person who has an addiction disorder is. And that's what I've been treating for the last 25 years. People who have an illness. And so one of the things that we're going to have to do with those poor folks who now all of a sudden don't have a provider is help them understand, look, you are a person, you have an illness, maybe several illnesses now, and the goal for you is to get you treatment, to treat you in a proper way, in an evidence-based way that restores optimal function, that tries to get as close as possible to life repair and to long-term stable recovery and wellness. That's our goal. And it means that by definition, we're not stigmatizing people anymore. We're not looking at people as if they've done something wrong. Right. They have done nothing wrong. Clearly, some of these doctors have done a lot wrong. Right. But the people who have been their patients, and quite frankly, let's face it, they've been their victims, need to feel free and welcomed to come to other doctors in the community, to other providers who are available to try to provide them the help that they need.
What would you tell someone in that search to look for program?
One of the things you want to know is, are you going to provide me help for my pain that doesn't just involve ramping me up on high doses of potentially addictive medicines? Number one. Number two, are you aware of other kinds of modalities that can provide me help for pain that will increase my ability to function and not just have me sitting around feeling the effects of a pain medication? Do you know anything about the disease of addiction and how properly to treat it? And the combination of pain and addiction and how to treat that combination. Are you aware of, for example, the principles of addiction treatment that the National Institutes on Drug Abuse has published based on 50 years of research that tell us what the proper way is to treat someone who has an addiction problem? Are you aware of the current standards for proper pain treatment for people with chronic non-cancer pain? I mean, those are the kinds of questions that patients should be asking doctors and listening very carefully for the answers, because it's not just about what some doctors are interested in doing, which is just doing procedures that make a lot of money and give people temporary pain relief, or, as some of these folks that have been arrested were doing, just ramping people up on outrageously high doses of addictive opioids.
Yeah. Well, thank you so much for your time. Thank you so much for talking to us about it. And thank you all for watching and for joining us. We really hope that you find this informative and that you're able to take the next steps. If you're watching this and you need to take some next steps to to finding great treatment and care options for substance use disorders or for chronic pain or for addiction, we just want you to know that care is accessible, that it's affordable, that it's there. We'd be glad to help you. But there are also many, many treatment centers doing great evidence-based care, and we encourage you to do the work to get involved with a treatment program today that we believe, without a doubt, can save your life. So thanks so much, Dr. Taylor. Thank you, Chase.
Thank you.
Y'all have a great day.
You too.